Welcome back. You're at the Faculty Factory Podcast, and I'm Kim Skorupski at the University of Texas Medical Branch in gorgeous Galveston, Texas. Looking at a friend and colleague from way back, I'm so excited to see her and be with her today, Dr. Angela Sharkey. Hi, Angela.
Good morning, Kim. Glad to be here.
Thank you so much. Friends, you are in for a treat. Let me tell you, if you don't know anything about Dr. Angela Sharkey, it's pretty impressive. And there are a couple podcasts that she's done in the past with us, and I'll point to them in a minute. But Dr. Angela Sharkey, MD, Professor Emeritus, Pediatrics at Wake Forest University School of Medicine, had a multi-decade career in academic medicine, was actively engaging in patient care, health professions education, and clinical research. She held leadership roles in 4 academic institutions, was nationally recognized for her care of pediatric patients with Marfan syndrome, and for her expertise in medical education and training, faculty development, and academic affairs. During her tenure in academic medicine, Dr. Sharkey mentored many medical students, residents, fellows, and faculty. And after a long and successful career, Dr. Sharkey retired in 2025. She still presents on a national level on strategic career planning, conflict management, and other faculty development topics. And that is why I have invited her here today. We have had many conversations over the years. And if you haven't taken advantage of the AAMC workshop and boot camp on managing and mediating conflict, that's where I circled back and saw Angela, gosh, a couple of years ago, I think the first time they offered that. It is fantastic. And in fact, it was so good. I've never seen or participated in a better conflict workshop then with Dr. Sharkey. You have to go do it. And it was so good that we invited her to participate in our faculty leadership mid-career boot camp that's open up to faculty around the world. She knocked it out of the park there. We're having her back again. It's great because you can apply the content immediately. It's so important. So she has been with us a couple times now on the Faculty Factory podcast, episode number 30, discussing her role as a senior associate dean at Wake Forest. Well, it was back in the day, gosh, Angela, almost 9 years ago. Dr. Sharkey is here because she and I have talked over the years, and when I learned she was preparing for life after employment outside of academia, it really inspired me to think about how we could compile a lot of resources for folks who are thinking about retirement and in the advanced career stages of our life. And so that's why Angela's here today. She has come up with this wonderful conversation for us around identity formation in anticipation of retirement. So thanks again, Angela. Sorry for the long intro, but you are near and dear to my heart personally, as a friend, as a colleague, as a mentor, and I am so happy to be with you today. Please share with us your wisdom and your experience and recommendations for this new stage of life.
Awesome. Thanks so much, Kim. And I really look forward to our conversation today. When I began to think about the possibility of stepping away from my academic career, I thought about what is my identity in academic medicine. And when I teach about strategic career planning, I talk about understanding your passion and your purpose and your people. And when I thought about retirement, I thought, well, I should be advising myself about the strategy of planning for retirement with my purpose, my passion, and my people. And think about who am I and who are they and how do I move forward into this really exciting time in my career. And what I began to realize is that when I thought about Angela Sharkey and my work, I was always connected to an academic institution. And when you introduce yourself, when you're in academic medicine, you say your name, your title, and your institution. And when you retire, you take that step away from that identity connected to an institution. And how is your ego tied up into that connection of name and academic institution?
Yeah, that's so obvious and yet not obvious to think of everywhere we go, even when we're on vacation or you're going to a wedding or something around the country that's not even work associated. People say, "Hey, who are you? How do you know the bride?" Or "What are you doing here in Bermuda?" That's immediately my primary status is my academic affiliation and what I do for a living. Isn't it
Right.
interesting that we don't say, "What do you love? What do you love about life? How are you living your life?" It's like, "Well, I'm this and I do that." It's so interesting. And then what about when you're not? Do we say, "I used to be"? Well, what are you now?
Exactly. Well, and think about even when you tell someone you're from a certain town or area of the country, if you're an MD or a PhD, they often ask you, "Oh, do you work at whatever academic institution happens to be in that town?"
Yeah.
So, what I did for myself in thinking about my passions and my purpose is think about how am I going to be without that academic institution connected to my name? And how do I develop my identity now independent of that academic institution?
Mm.
And for me, in my life at that time, I realized I was pretty ego driven and needed to be able to acknowledge that it was my ego that was driving that need to be connected to an institution. And perhaps a little humility on my part might help me be able to separate in retirement and have it be okay to just be Angela Sharkey.
Wow. What honesty to recognize that we do take a lot of stock in our affiliations and our degrees and our scholarship and our whatever, that's important to us. That's how we're socialized in this space. And yet, when we go out in the real world, a lot of times people couldn't care less. They want to know what kind of person are you? How are you contributing to your community? Who cares?
Yes.
Care how many do you tell? This is my CV. You don't hand that out when. Well, who cares?
What I would encourage people to consider as they approach retirement age is what is your passion? What is your purpose? How are you connected to your community? What fills your cup, as it were? Because often when we talk about retiring, we think about the vacations we're going to take, the travel we're going to do, and all of that is incredibly exciting. And most of us are not traveling 365 days out of the year. And so every week there's going to be a Tuesday at 10:30.
Mm.
Tuesday at 10:30 is not a scheduled podcast recording or a Zoom meeting or a patient encounter or research lab environment. It's Tuesday at 10:30.
Mm.
And every Tuesday at 10:30 isn't going to be full of excitement. So what are you going to do that makes you feel like you are fulfilling your purpose in this wonderful phase of life we call retirement?
You said something that I'm wondering if you could talk a little bit more about when we are approaching retirement age. What are your thoughts about retirement age? I'm a gerontologist and I love advanced career faculty. And I learned the hard way when I was at Hopkins, like you don't send emails to faculty who are age 50 and older, say, "Hey, you might be interested in this," because then
Mm.
right away the replies are like, "What are you trying to tell me, Kim? Do I need to retire? Do you know something I don't know? Why was this sent to me? What is the implicit message there?" And I'm like, it's okay, it's okay, it's okay, oh, it's okay. I was trying to just kind of target this to people who might. So, what is age? Is there some, sweet spot for age? Does age matter anymore? What are your thoughts on people of a certain generation, like our age and stage, in our early 60s and beyond, or this new generation? Do you have a sense that this discrete times and ages mean anything to anybody?
Well, Kim, you're going to have a lot more expertise in this area than I do. And what I experienced in my own life was the loss of two very dear friends who were
Mm.
both age 66 when they passed away.
Mm,
And it helped me pause and realize that I do take my good health for granted, and not all of us are blessed with good health forever. And that there's a window of opportunity, really, when our physical well being, if we've taken decent care of ourselves, is more likely to be present. And to me, that window is 65 to 75, maybe for some 65 to 80. And for me, that was the driver, my friends becoming ill and passing away, to say, I should not take this window of opportunity for granted.
yeah.
So that is what allowed me to begin to step back a bit from my busy schedule, figure out how to integrate life into my work because I was not good at that, and begin to think about how do I want to spend my time when I am not working.
Mm, mhm,
So again, for me, I started going to the gym more. That was what I fit into my day to think about my long-term well-being. So I began to explore my community. What were the efforts that community agencies were making to impact our community in a positive way? And where might I want to integrate myself in an intentional and purposeful way? Again, to fulfill my what I perceive to be my purpose and my passions.
mhm. So these kinds of conversations, I think about putting myself back when I was in my 40s and trying to get, promoted to associate professor and then on up the line and thinking about my career trajectory and who I was and where was going to be my niche focus and what will I be known for? All those kind of questions that we tackle in our careers. I would love it if we could like destigmatize old age and normalize the conversations that if you're listening to this podcast and you're a medical student, you're a PhD student, you're any way along the whole career continuum thinking, well, this is not for me. It's just like the beauty of compound interest when we invest in a pension system at our new employer, we start figuring out what our benefits will look like when we retire, and our stocks and bonds and mutual funds and all those kind of confusing things. Social investment, social networks. I saw the shirt you're wearing today about social community and network. Our network is our net worth. So the idea of not only investing in our future financial security, but our future mental, social, spiritual, emotional security. So in that vein, it's never too early because again, compound interest. If you started investing early, you can run the numbers and see how valuable that effort would be and that exercise. And similarly, if we can just start being chill about talking about what happens in our advanced career stages, that this is just a normal next step that investing wisely may allow us to have a longer course in the go-go years. As in aging, we talk about the go-go, slow go, no go. And so we want to expand that go-go years where we can do like what you're saying, Angela. So I like how you're pointing out this thinking about as we approach it, and these seminal moments may help kind of shock us into reality of, oh my gosh, I had no idea I'm this age or that age. And also realizing we don't have to wait for that big event to happen to
Mhm.
kind of, smack us into reality. We can be very thoughtful and purposeful earlier in our lives. And I don't think we've done a good job in academic health or probably any industry to prepare for that transitioning phase and maybe getting more flexible hours and going part-time or playing with different areas or facets of our passions and stepping a little away from this and adding a little bit of that. So that's why I think this conversation is so important, that how learning how people like you have done this and thought about it and what was the catalyst and how it's working out for you. So
Kim, one of the things you mentioned was relating to people, the social network. And I also would emphasize in thinking about strategies for your career, for your phased retirement, or for your full retirement, that building your social network both that within work, who are your friends going to be when you're not coming to the office every day, but also outside of work. And that is so important to keep us young and going. I really like that. Now, you mentioned in your comments also going part-time. So let's explore that a little bit, if you don't mind.
Yeah.
And I think that you would probably agree with me, there is some hazard in
Yeah.
part-time work.
Yep.
And whether you're early in your career, mid-career, or late career, there's hazard in part-time work. From the standpoint that you may decide to continue to work part-time to maintain benefits, or you may actually have to invest more to maintain benefits when you're less than full-time, depending on the institution you're associated with.
Right.
And often people who say they're going to work part-time end up working way more than part-time. And
Agreed.
you drop your compensation, but not necessarily your workload.
Yeah. Why do we think we can do that? We know, is it some kind of, I'm sure there's psychological component to this that we overestimate our capacity. I guess we do this our whole careers. We overestimate our ability, the time available to do things. We're like, I can do that. I can keep myself to 20 hours a week. I can just make sure I only use the discipline to only do 10 hours, a week on that. And then it inevitably, why are we so bad at that?
Maybe it's ego. Maybe it is.
Oh, back to that. Yes.
Mm. Well, I think that that my advice for someone who's considering a phased retirement or a transition to part-time before full retirement is that think about the strategies to keep your work separate from your personal so that you can really realize the full benefit of that part-time work. And so some strategies that I would consider are removing your work email from your phone so that it's
Mm,
not in your hand all the time, but that you have to be very intentional to access that email.
yeah.
And another thing that you and I have talked about is how do you stay in touch when you are no longer working? And how do people who you worked with know when you will respond to an email they send you? So, my academic institution, Wake Forest, when you become an emeritus faculty, you retain your Wake Forest email. And therefore, I have a work email still, and colleagues can reach me through that email. But that email is not on my phone, so I do not check it every day. I have to be very intentional to go, and I have calendared, check my email every 2 weeks. I have an event on my calendar. Check your email, work email today. And so what I need to do, and I haven't done, is put an out of office notice on my work email that lets people know I'm not going to respond to this email immediately and that I will in a 2 week interval so that they know the timeline for when I'll get back to them. Do you have other
Angela,
strategies or ideas?
no, I was just going to ask you if you found a support program, like an email anonymous 12-step program to help you get away from that checking email every day, because I've not met one person who doesn't complain about email. And so that's going cold turkey. I mean, how do you I recently deleted YouTube from my phone because when I wake up in the middle of the night, I get on those, stupid dog videos that are so adorable. And I just, goes one to another, and I end up watching 45 minutes of YouTubes. And I'm like, this is ridiculous. I literally like deleted it from my phone. And so far I'm not buying as much junk, which is good. And I'm going back to sleep. So I'm evidencing the benefits of taking something off of my phone, that digital dopamine hit that we're so used to. And so I'm just wondering, I'm being facetious, like, how was that experience of on some day you were like, delete, and did you feel like you're missing stuff? Was it easy? How did you experience that constant ping, 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 ping of
You're
email?
you're just too funny. So what I will respond in answer to that, which might not be the full truth and nothing but the truth, but about 2 years ago, I started listening to the Healthy Minds podcast. It's produced out of the University of Wisconsin. Richie Davidson is the PhD who has done an enormous amount of research on meditation, mindfulness, and brain activity. While I was walking my dog every day, I'd turn on that podcast and listen to a meditation about just being present in the moment. And that's what helped me separate from the social media addiction
Oh,
was an intentional focus on being present in the moment.
wow.
And to your point, we are really addicted to these devices we carry around in our hands. And there are companies who are trying to maintain that addiction for us. And it requires us to be very mindful to separate from that.
Yeah.
So I had put Facebook or Instagram off my phone onto another device. So I have to be very intentional that I'm going to focus my time on that. Now, I'll tell you, Kim, since I've retired, I find that I'm spending a lot of time on my phone, and it's something at least I'm mindful of, and I'm trying to figure out what do I do with that. And part of the reason I'm on my phone is because I'm looking for places to stay while I'm
Oh,
traveling, right? And all of that is on your phone. I'm also having time to go to a restaurant more for lunch or for dinner. And now there are QR codes for
oh my,
the menus. You have to ask for a paper menu so that you're not looking at the menu on your phone. So anyhow, I really would recommend some sort of mindfulness activity to help begin to just recognize if you're on your phone and you're looking at YouTube, that you're on your phone and you're looking at YouTube and you make the choice. Is this what I want to do now? Or should I move to
yeah.
something else?
Yeah. Did you feel when you, and you're being honest about this, but reflecting back on the work emails, can you put yourself back in a moment when you had stopped with all the meetings and the committees and the work, the administrative work, Epic and the notes and the thises and the that's and the papers. Do you remember a moment when you kind of had that, oh, I'm not doing that anymore? Was there anything that you can recollect of how that transition felt to you or how it looked to you?
What I guess I would tell you I noticed is I started sleeping through the night and I didn't wake up fretful and thoughtful and tense about what the next day held for me.
Oh my gosh.
And that was when I realized this is really a healthy transition. That not working does not mean you're not living, but it
Ooh,
might mean that your opportunity to live well has been enhanced.
we need to say that again. Not working does not mean you're not living. I think that's so profound. And it's a almost, I would wager a bet it's a uniquely American or a US experience
Oh, mm.
that we equate if you're not in the game, collecting the big salary, doing the papers, doing the research, seeing the patients, teaching the students, if you're not working, you're not living. Wow, what a weird way to think of being. That
You're
one
so
must
right.
work to be alive? Are you serious? What a mind shift. I love that. Not working does not equate to not living. Working is not living.
Now, you said something in your comments just then about financial well-being. So let's touch on that just for a little
Yeah.
bit if we can. First of all, it was kind of terrifying to think I'm not going to have a paycheck every 2 weeks or every month, depending on what your pay cycle is. How do I have money to live?
Yeah.
Where does that come from if it's not coming from outside? And so I want to, especially for the early career, mid-career people who might listen to the podcast, to say, for goodness sake, put money away for your retirement. And if your organization matches that, make sure that you put in as much as you can to ensure that you get that match. But then the other thing that I was not good at, Kim, was paying attention to my portfolio.
Mhm.
So if I'm not going to do that, I need to have someone who's doing it for me. But shame on me, even for mm, for delegating that important responsibility to somebody else.
Yeah.
So that's something that I did not make time in my day or in my week for. And in retrospect, I wish I would have. Now, fortunately for me, my investments worked out very well.
When you think about as scientists how we are so uber responsible as the PI, as the, attending or as the lead whatever, that this is my place, my shop, my whatever. But when you think about your future financial solvency, you're like, well, it's in some cloud somewhere. I was meeting with my financial advisor, bless his heart. I swear he looks like he's 12 years old and he's a genius, clearly. But I thought, as far as I know, he could be taking all my money right now. He like tapped into my computer and he was click, 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 click. And I'm thinking, like you said, shame on you, Kim, for not knowing what is going on here and then again, how easy it is and tragic, and this is a different podcast topic, to be scammed, how people prey on us when we are not aware. So that is another, I think, important thing that we should be. I don't want to should as a coach, we shouldn't should all over ourselves, but we should. It's important that we pay attention to that and prepare for that. And it's shocking how much we trust just some magical thing that's going to happen. So you're right. What will happen? But who knows? I mean, it's scary. It's scary.
Well, and what gave me comfort as I was beginning this transition to retirement was tracking my spending each month for 6 months to say, okay, now if I amortize that over a year, how much am I spending each year? And how much, therefore, do I need in my retirement account? And I realized I had more than enough. And I met with my financial advisor and we went through my portfolio. And yes, I can live until I'm 95. God willing, my
Yeah.
health would last that long.
Right.
And the practicality of that is low. So anyway,
Yeah.
uh,
Well,
uh,
that's a another great strategy you're saying. Just again, easy for us. Keep track. Keep track on the expenses and then what would be optional that you wouldn't necessarily in retirement be spending a lot of money on whatever business clothing because you're not going to be wearing clothes like that or
right.
whatever.
Yeah, and you mentioned all these different institutional connections for our retirement plans, and all of those organizations offer the opportunity to meet with an advisor from their
Yeah.
company to review your portfolio and your investment strategies and et cetera, et cetera. So I would take advantage of that if I were to probably do this all over again.
Yeah. Yeah.
Okay, so let me think about also healthcare. Another challenge for us in America, and the reason people continue to work often is so they have that benefit of healthcare.
Yeah.
I was fortunate enough to just by happenstance attend a webinar that was put on by one of the retirement companies that Wake Forest utilized for our faculty and staff investments. And that particular webinar, the gentleman talked about Medicare and how you should start planning for Medicare, not when you're 65 and beyond, but at least when you're 63, if not before. And the reason for that is multiple. But the fact of the matter is, Medicare isn't free, right?
Mhm.
You're going to pay for that healthcare benefit just like you pay for your healthcare benefits at work. And actually, you may pay more for Medicare than what you pay for your benefits at work when you have healthcare through your employer.
Yeah.
And what you pay is determined by what you make in the last 2 years that you are working. So that information I gathered from that webinar and have shared with all of my friends and colleagues since, because it's not necessarily a well-known point, and it can work to your advantage if you're thinking you want to work less than full time. Maybe that's a good idea. And pay attention to go on to Medicare.gov, see what the cost is based on your income bracket, and begin to strategize about how to optimize. We all get the same Medicare, but we don't all pay the same price.
So it's
But
almost a
again, I'm not an expert in this field, so I don't want
no, no,
every
no.
to rely on our conversation. Rather go to medicare.gov or if you have a financial advisor, our financial advisor outside of work had a consultant that we could work with to help us figure all this out and also to help figure out a supplemental plan because Medicare covers your inpatient, but not your outpatient expenses. So you need a supplement plan to support the outpatient side of healthcare.
Ugh.
I know. And actually, another really important thing, because I know that you have a business meeting abroad this summer, is that Medicare only covers when you're in the United States. So if you are traveling abroad, you need healthcare coverage.
Oh my gosh, did not know that either.
These retirement things that we all have to figure out.
See, and that's yes, and yes, but I'm going to say but there. I think that's why we do a disservice to our employees, especially in academic health. We're academic. Like this is part of you live the life of the mind that this kind of information should be common knowledge. Who wants to, fall off a cliff when they get there? We all want to have some sense of control, some sense of predictability, some sense of being able to forecast with some amount of reliability. And to not know this, I think, this is why, as leaders in academic health, this is something we need to be mindful of. And as faculty in academic health, this is something we should demand that we are informed and fully transparent of what to expect. So important. Thank you, Angela.
Okay, one other thing I really would benefit from us focusing on, besides benefits,
Ta-dun-dun.
is the benefit of self-care and the
Okay.
importance of self-care as you are transitioning to retirement. So I mentioned my mindfulness focus because for me, I needed to get comfortable in my headspace about that identity transition that would occur when I stepped away from work. And like I said, I started exercising. I really made it an intentional decision to integrate that into my workday. I know some of my friends amongst you who have been very intentional to do that all along, but that was not me. So I have done that. I've made sure that I have a primary care doctor because I have moved from my location where I was living before to a new location. And I think it's really incredibly important that we, as academic healthcare educators, researchers, and care providers, make sure we take care of ourselves too.
Mhm, mhm.
And so being really intentional to think about what other self-care, how you eat, how you drink, uh, and how you spend time with other people. Because what we've learned in the last 10 years, haven't we, is that being in isolation is not good for us.
That's right. That's right. Yeah. In fact, there's research showing that isolation is tied to morbidity, even mortality. So we
And
have
I think, Kim, also in the geriatric literature, even more importantly, right? Because one of the challenges of not being mobile and being intentional about maintaining your mobility is that you become increasingly isolated.
Mhm. If wouldn't mind just a couple minutes, I want to circle back, kind of like capstoning this. You started us off talking about passion, purpose, and people. And it's been stuck in my head and I can't get rid of it. I meet faculty every day, as you know, and you did, and where I feel like they've identified their passion was to be a pediatric cardiologist, la 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 la, fill in the blanks, whatever. And then I sometimes ask them, well, why is that? How'd that happen? And is that still a passion? And there's sometimes this kind of curiosity about, I don't know if I'm passionate about this anymore. It's I've done this surgical procedure a million times, and that's like almost the dead eye look of, I don't, if this is the rest of my life, I don't know if I can do it. It's the same, same, same. Could you just, I know I don't want to go too far afield on this, but What are your experiences with helping or insights about identifying one's passion when we've been so laser focused, and we train people to go deep and get your niche area and be really focused and kind of be very narrow in your expertise, and that's your impact, and you become, that's your thing. How do you advise or think about when I, say the things that you did about, your identity, your purpose, your meaning, your community, and people kind of look at you like, I just told you what it is. I'm an intensivist. And they're like, well, yes, and what are your strategies or thoughts about helping people to see possibility of in themselves that they haven't quite tapped into?
So I love your sense of our training, MDs, PhDs. We are trained to be laser focused for probably more for the MDs than the PhDs, but likely also true for PhDs. We also have this defined path that we're supposed to follow, right? Our education requires this many years. Our postdoctoral training requires us to accomplish these goals. And so that does cause us to be forward and maybe like a racehorse with blinders on, right? We're
Yeah.
down this track and here we go and we're going to cross the finish line. Um, what I would say in terms of thinking about your passions and your purpose is that you take time to reflect on that every year at least, if not every 3 years at the longest, and identify where you still derive your greatest joy and satisfaction in your work.
Mm.
And the other thing that my first division chief said to me long, long ago was never say no. Okay, well, I think that's bad advice. You should, but you should be open to opportunities that you would think, I don't know why somebody's asking me to do that. But in fact, maybe they have seen a talent, a passion in you that you yourself have not yet identified, and
Mm.
follow that opportunity for a while and see, does it help you feel better every day going to work? Or does it not add joy? It just adds work. And then
Mm.
make a decision about whether to continue or to step away.
Mm. I love that, and you're making me think, Angela, about what you said earlier, the value in being in community and being in social environments with your loved ones, siblings, long-standing friends, colleagues, neighbors, that reflection of ourselves in other people's eyes. As a sociologist I mentioned before, Charles Horton Cooley, each to each a looking glass reflects the other, that doth pass. We see ourselves in other people's eyes. And when you're around people and we purposely put ourselves in environments where there are other people, we may see reflections of ourselves that we didn't know or forgot about. Or as you were saying, if someone's asked us, why are they asking me? Well, because you're so good at that. I am. Anybody could do that. No, Angela, that's uniquely you. Oh, I had no idea.
I think the other way to close would be to say we really have talked about the importance of financial and physical health.
Mhm.
And the final piece we've just reflected on, I would say, is the importance of our mental
Mhm.
well-being.
Yes.
And and mental well-being for different individuals comes from different places. But even for the greatest introvert of all, and I'm pointing to myself, people are really important. And the ability to say yes to people that we care about, that we want to spend time with, that make us a better person for being with them, having the opportunity to have that yes and a no to people who bring us down, who don't build us up, who don't bring us joy, and the time of retirement and the freedom of retirement allows you to do all of those things. And that's why I would say that I am greatly blessed to be where I am today. And I would encourage others to reflect on having this time in life is a great gift. and we should take advantage of it.
Dr. Angela Sharkey, thank you so much. We'll see you next time on the Faculty Factory Podcast. Thanks for tuning in to the Faculty Factory Podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory Podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.